Okay, it is 8:30, and I will call the meeting of the board, county board, to order at this time. And our invocation, let's see, I think that would be the first item on the agenda, will be a moment of silence, or we'll hear from Rhs Fund, I believe the pronunciation is, Society of Hinduism. Please rise.
Can you hear me?
Yes, thank you.
My hearty thanks to Chair David Peterson and other supervisors and Administrator Witt for scheduling me to read Invocation for the great county of St. Croix. I shall be reading in Sanskrit from ancient Hindu scriptures, some as old as 1500 BCE, and then interpret in English. Om Bhurvubhaha Svaha Tat Saviturvarenyam Bhargo Devasya Dhimahi Dio Yona Prachodayat. We meditate on the transcendental glory of the Deity Supreme, who's inside the heart of the earth, inside the life of the sky, and inside the soul of the heaven. May He stimulate and illuminate our minds. Astoma Sadgamya Tamsoma Jyotirgamya Mrityor Mamratam Gamya. Lead us from the unreal to the real. Lead us from darkness to light. Lead us from death to immortality. Tasmada Sakta Statam Karyam Karma Samachara Sakto Hai Charan Karma Parmapanoti Purusha Karma Neva Hi Samsiddhi Mastita Jankadya Lokasagreha Mevapi Sampa Shankar Tumrahasi. Strive constantly to serve the welfare of the world by devotion to selfless. One attains the supreme goal of life. Do your work with the welfare of others always in mind. Om Saha Navavatu, Saha Nobanaktu, Saha Viryan Karba Bahai, Tejasvi Navadita Mastu, Ma Vidvisa Bahai. May we be protected together. May we be nourished together. May we work together with great vigor. May our study be enlightening. May no obstacle arise between us. Samniva Akuti, Samna Hirdhyaniva, Samna Mastuvo Mano, Yathava Susa Hasti. United your resolve, united your hearts. May your spirits be at one, that you may long together dwell in unity and concord. Om Shanti, Shanti, Shanti. Peace, peace, peace be unto all. Om. Thank you.
Next item will be roll call. Cindy, please.
Ed Schachner.
Present.
Sean Anderson. Bob Long is absent. Kathy Leaf.
Present.
Kara Cook.
Present.
Tim Hall. Is he there? Okay. Paul Burning.
Here.
Present. Rick Otino.
Present.
Bob Fiedler.
Present.
Dave Osnes. Scott Coner.
Present.
Dan Hansen.
Present.
Scotty Ard.
Present.
Greg Telejohn.
Present.
Dave Peterson.
Here.
Paulette Anderson.
Present.
Judy Achterhoff.
In attendance.
Thank you. Shelley Tomschick. Shelley? Okay. And Bill Peavy?
Present.
And Sean Anderson is present.
I agree with Judy again.
Okay, the first item then would be public comment. We'll allow 2 minutes per commenter today. First request I have is from Michelle Dennison.
Can't hear anything.
Yep, can't hear. We missed the pledge too.
Can I start from the beginning? Yeah. Okay. Several people, myself included, have been asking our county board and health officials a simple question. What cycle threshold is being used for the PCR tests in this county? The answer finally received this weekend was vague and basically said that the state runs the tests and not the county, and therefore the county does not know what cycle thresholds are being used. On December 14th, 2020, the World Health Organization quietly admitted that the PCR test is a hit and miss with way too many false positives. The WHO said that all labs should report the cycle threshold to treating physicians. A court case in Portugal ruled that the PCR test is not fit for purpose. Chances are high that we will be talking about this virus for a long time. Therefore, the question of the cycle thresholds becomes extremely relevant to understand the accuracy of the county dashboard data. The state labs which run these high complexity tests should easily be able to tell our county health board what cycle thresholds are being used for the PCR tests. I also asked about flu cases. The response I received is that there is very little influenza across the state or locally, with 0 hospitalizations in our county related to influenza this season. Let me repeat, there were 0 hospitalizations. While we are told we cannot compare COVID with other respiratory illness or disease, how is this lack of flu this season not extremely relevant and vital information? If you say that the mask and social distancing are the reasons for this, how does this prevent the spread of one virus and not another? We do not have a valid explanation as to why there is virtually no flu this season and must therefore suspect that we are not being given accurate and honest information. Starting with the cycle thresholds for the PCR tests, which inflate case numbers and keep us in a perpetual red zone. Kelly Engen, this is important information that you should request from the state labs. What PCR cycle thresholds are being used? Thank you for your time.
Debbie Kraft.
Good morning. My name's Debbie Kraft. Today I'd like to ask that information on the website, the county's website, with regard to COVID-19 be updated. There's been a number of new releases of information, including that recently by the World Health Organization, which Michelle alluded to. I don't see any information about that, which I think is vital to people's ability to be able to make informed decisions. So I would like to see information about the PCR test and the cycles, and the fact that one PCR test no longer is considered valid for a positive COVID case. Further, there have been a number of studies. In fact, the small sample of things that I found with regard to the use of vitamin D and the fact that there's a direct correlation between vitamin D and vitamin D deficiencies and the instances of COVID cases, positive COVID cases, and also the severity of those cases, hospitalizations required with lower vitamin D or with vitamin D deficiencies. So given that, and given the stated policy with regard to the county health department informing the public, and that you want that website to be an information resource for the public, having information with regard to vitamin D and its potential to keep our population healthy, I think is a must. Please look into that. Thank you.
Jen Flanders.
morning. I stand before you today as a concerned citizen of St. Croix County. I'm concerned that our boards are still promoting propaganda when there is zero proof that lockdowns, masks, or social distancing help prevent the spread of COVID. I'm concerned that proven measures of building immunity and therapeutics such as HCQ or ivermectin, along with vitamin D supplementation, are being withheld from the community. Ivermectin has a 100% efficacy rate, by the way, at last count, and instead are being told that ventilation is their option, which was proven almost 8 months ago was actually causing death. I'm concerned that members of this board want to offer bribes to businesses to comply with unconstitutional mandates. Kara and Bob Long, bribery is a felony. I'm concerned that using psychological manipulation like this money is meant to be a reward for good behavior is no different than a mob tactic or that used by the Nazis and communists. I'm concerned that while up to 17% of the working population of St. Croix County was unemployed, this board was voting in raises for themselves or some of the departments and to ensure that government employees get paid for all missed work. Why isn't this money used to help those who haven't been able to work consistently for the past 10 months. Our businesses are dying because they can't function at 25, 50, or even 75% capacity. And those that are willing to defy state guidelines are being targeted by unconstitutional resolutions like the Hudson Safer Initiative, or denying them stimulus money such as proposed by the admin committee. The HHS board is not doing their duty in making the public aware of all options to fight this or any virus, and instead continue to perpetrate propaganda. I ask, no demand, that Kathy Leaf, Greg Telejohn, Kelly Egan, Ellie, and
Please
Paul
do not use
McGinnis
personal names
be
on this.
removed from
Do
the
not use
HHS
personal
board,
names.
and that other health professionals such as Dr. Ed
Time
Hagan
is up.
be admitted to the health board. Thank you.
Is there anyone else who wishes to make public comment at this time? Seeing none, we'll move on with the business items. Consent agenda. Do we have a motion? Oops, no. State your name and you have 2 minutes.
Hi, thank you. Lynn Betzel. I would just like to ask a few questions this morning, just get us thinking about that. Asking questions is okay. First of all, why is a vaccine that is not FDA approved being promoted? The answer I understand is because we are in an emergency, a state of emergency in our county. And that's why that emergency status is wanted to continue, is my understanding. However, this county, I believe, presented the emergency status so that there could be staff flexibility. However, now that I understand more about the vaccine promotion, this vaccine couldn't continue and be promoted unless there was an emergency status in the county. So I just have some questions about how that was working. I went to my doctor and found out that she couldn't write vaccination exemptions. Just wondering why that is. The same clinic that is like more homeopathic, more outside the box thinking, also had absolutely no exceptions for mask wearing. Everyone had to wear a mask no matter what. Why are doctors allowed to invest in vaccination stocks? Wouldn't that be a conflict of interest? Why are churches not trusting in the healing power of prayer, but instead put up more plexiglass? Why does the clerk at the grocery store sound like Darth Vader as she tries to breathe? And it's very disconcerting to stand there and watch her struggle to breathe. The same business is one of the very few that post the exemption that health reasons, you don't have to force masking. And yet their own staff at that same place is struggling to breathe. Let's continue to ask questions. Thank you.
Is there anyone else who wishes to make public comment? Seeing none, public comment is closed at this time. We'll proceed on with the consent agenda. Do I have a motion to approve?
Move to approve.
Motion by Supervisor Burning, second by Supervisor Cowner. Discussion.
Judy Octoroff.
Supervisor Achterhoff.
I just have one question. I read through where everybody's supposed to be coming from, and I understand that the two being appointed are public school and private school, but they're both from Hudson. I'm wondering where the homeschooling is from. Does anybody there know where in the county the homeschool representative resides?
Corp Counsel, your thoughts on that? Do we need to pull that from the agenda to discuss it, or would the answer suffice if Supervisor Achterhoff is okay with that?
Well, I think the answer would suffice. If you want to vote on it separately, it can be, but consent agenda typically doesn't involve discussion.
Then I would request to remove it from the consent agenda. It won't be a long discussion, but I would like an answer to my question.
Okay, that will be removed from the consent agenda. Any other discussion on the consent agenda? Okay, seeing none, we're ready to vote on the consent agenda as amended. All those in favor signify by saying aye.
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 And opposed? One negative, okay, and motion carries. Now the discussion on the Achterhoff question. Go ahead, Supervisor Achterhoff, or...
Oh, yeah, it goes back just one. I mean, I realize that every school district is represented, but there's 3 parents, and I'm wondering, like, since 2 of them are from Hudson, I'm wondering if the homeschool one is outside of Hudson, so that we get a little bit more broader perspective in regards to the parents on this committee. That's why I was just wondering where the homeschool representative is from or resides.
Thank you, Supervisor Achterhoff. So we do not have a homeschool parent on this list yet, so that is a vacant seat. So if you have any recommendations, I'd be happy to entertain them.
I will look into it.
Yeah. So we asked around, and the school district was able to provide some names. We did check with some of the parochial schools for the names. And so these were the 2 that we were able to generate. We were not able to identify the 3rd open seat.
Okay, I will check on the homeschool and get back to you when I have some names. Thanks.
Thank you.
Okay, do I have a motion to...
Chair, there probably should be a motion to approve the appointments slated for the committee, and then, of course, later on it'll be brought back probably next month for some other appointment.
Okay, so just a motion now to approve.
A motion to approve the 2 names.
Okay. So do I have a motion to approve the 2 names presented? Supervisor Austin.
Second.
Second by Supervisor Burning. Discussion? All those in favor signify by saying aye. Aye.
Aye.
And opposed? It sounded like there might have been one. A motion carries. Thank you. Okay, that next then will be the presentation or recognitions.
So public health.
Okay. Public health, Kelly, are you taking that?
Morning. Yep, we are here. Thank you for having us. I think Ellie, our epidemiologist, is going to start, and then I can talk a little bit about vaccine rollout.
Great, thanks, Kelly. I'm going to go ahead and share my screen. Good morning. Thank you for having me. As Kelly said, my name is Ellie Clausen. I'm the epidemiologist for the St. Croix County Department of Public Health. I'm here to give an update on COVID in our community. In brief summary, we have now surpassed 7,500 total cases within St. Croix County. These are individuals who have tested positive. We currently have 18% of people testing positive. From within the COVID spectrum, we have 8 current hospitalizations due to COVID in Western Wisconsin. And we have had total of 45 deaths of St. Croix County residents due to COVID. On the vaccine side, we have 8,140 vaccines have been delivered to St. Croix County residents, including first and second doses. I'll get into the details of that towards the end. Looking at the current COVID status here at St. Croix County, we are seeing approximately 26 cases per day. So this is always looking at a 7-day average, which allows for the highs during the weeks and the lows during the weekends to balance out. So we're seeing still about 26 cases per day. Yesterday we saw 23, about half and half. You can see 13 were the molecular tests and 10 were the antigen tests. That puts us at what in a case per case incident rate. So kind of our number of cases by census, we're roughly at 19. What does that mean, 19? 19 means that we're considered an orange level if we look at the risk indicators set by the Harvard School of Public Health in association with Brown University. Orange does mean accelerated spread. So there still is quite widespread spread within our county of COVID-19. But on a good note, we are seeing a continual decrease in the number of average cases per day. So as we can see, since our max out in November, we are still currently on a decline. And that's great to see. What we can hope is that that trend continues and we do move from that accelerated spread, that orange level, into a yellow where it's community spread, or into a much lower rate of cases by census. If we do look at the way our cases are counted, you will find that if you click on that link for more information, that we're actually classified in St. Croix County at the red level. So at the tipping point, at 25 or more new cases per 100,000 population. It all does depend on how we count those new cases in, but the total number of cases remains the same. We can see in our cumulative number of cases, antigens still do contribute to our total positives for our county. Okay. Now, looking at that current COVID status, the state of Wisconsin classifies us down there at the bottom, our disease activity at high. What are they looking at there? They're looking at our population size, our number of cases, and kind of our trend in cases increasing or decreasing. So while Wisconsin remains at very high, it's good to note that St. Croix County is at high. There still are obviously the medium and the low levels to achieve, but we are no longer at a very high level. If we look at the bar graph on top of that, we're kind of seeing the average age of cases of St. Croix County of cases of COVID-19 in St. Croix County. I apologize. We do see an average age of 41 years old for active cases and 39 years old for total number of cases. So the most likely to have COVID within our county is in that higher age range. Where in Minnesota, we're seeing the 20-year-olds. Here in St. Croix County, we see the 40-year-old age ranges, kind of that bumping higher from that 50 to 59 and that 40 to 49-year-old age ranges. What isn't classified here is, but I wanted to note that the highest reason for the spread of COVID-19 identified by positive individuals is community acquired. So St. Croix County residents identifying that they acquired COVID-19 within the community. The second highest reason for the acquisition of an infection of COVID-19 was household spread. So within that household, they were passing the infection. That continues to be a predominant way that our school children are infected, is through household spread. We still see a 50-50% there with the circle graph of gender and the grand majority of ethnicity. These numbers, as they get updated weekly, actually do not change. So this is kind of, this is a continuing trend in our county that we have about 51% female, 49% male, and the greatest proportion being non-Hispanic or Latino. Okay, what you see in that bottom piece for Wisconsin and St. Croix County, the comparison there, we're seeing percent positive. That will be addressed after the hospitalization and death slide. So in looking at hospitalizations and deaths, what we currently know is that there are 8 COVID patients hospitalized across Western Wisconsin hospitals. Those are listed down there, going from Polk, St. Croix County, and Pierce. And we have seen a total of 45 deaths. These are, again, I want to say that these are deaths counted only when COVID is listed as the cause or a contributing factor to the death of the individual in St. Croix County. That has been verified and then added as a death for our county. What this does mean is there may be some individuals who have passed due to COVID but have not been counted yet, as their death certificate has not been made available. Okay. We do see the greatest number of COVID-19 deaths in our community in the 70 to 79-year-olds. We have seen 17 of those individuals of the 45. With gender, it is predominantly male. We have 33 in comparison to 12 deaths. Unfortunately, that is a difference, and it is a difference worth exploring. It is a trend that carries throughout the United States, and the reasons behind that trend has been explored. But for us at St. Croix County, 45 is too low of a number for us really to do any in-depth investigation into why the deaths are happening in this manner within our county itself. We would not be able to statistically say this was an actual reason behind that death. Okay. Moving back to percent positive, here in St. Croix County, we're seeing an 18% positive COVID test by person. So the individuals tested, 18% are positive. We are seeing a trend in this percent positive decreasing, that the 7-day average of percent positive is going down, which is great. Percent positive is used as a metric to see if there is enough widespread testing in order to really define and find the disease in our community, where our investigations and our control methods in testing and in tracing them can be really effective at clustering the disease and preventing spread. This is in balance, of course, with the number of individuals tested. So just yesterday, we only had we had under 50 individuals tested. You can see by the bar here is 50 here, a number of people have tested. And so we would like to see more testing just to be able to really identify where the disease is in our community. So if you're identified as a close contact, or you do have any symptoms that are new related to COVID, we do ask that you go in for testing. The WHO and CDC have aligned, and they are looking for 5% or lower in percent positive for about 14 days before they're really able to say, yep, we've got a really good handle at finding the disease in our community. Okay. Just of note, which I believe has been of interest to individuals, and I wanted to note here, looking at influenza numbers in our community, or excuse me, not in our community, across the state. So these are state numbers. These are provided by the DHS. These numbers can be found on the link above, if you just do a basic web search for Department of Health Wisconsin influenza. They do release a respiratory report. The last respiratory report to be released ended on the 23rd of January, and we can see that on the top graph, the red bar there, are influenza amounts of 2021, or our activity. The trend is very low. Now, as has been mentioned, is that influenza is not reported unless it is a hospitalization. But in comparison, right now we are at a current number of 10 hospitalizations from October to present. And last year we had, during the entire flu season, we had 4,425 influenza hospitalizations last year. So not at this time in total, but as of this time, we only have 10, okay? But more information can be found on the Department of Health website. Transitioning back to COVID, looking at our vaccination and the vaccination that has been done across our county. This is the page from our current dashboard and is available on a daily basis for anyone to examine the vaccination numbers and the rest of the numbers that were presented in this presentation. We have seen over 8,000 vaccines administered to St. Croix County residents. So this is by all vaccine providers. So whether someone was a St. Croix County resident and being vaccinated in Minnesota, in Pierce, or in Polk, we are counting them in this number. Almost 7,000 have received the first dose. Just over 1,000 have received their second dose, which would complete the vaccination series for COVID-19. In St. Croix County, we are currently at 1A and B, and I know Kelly will address this in her presentation. What these graphs are showing you here, we are looking at the timeline of vaccine distribution for St. Croix County residents in first dose and second dose. We have a second graph here, if you toggle either down or across, and you can see this is our St. Croix County Public Health vaccination supply. This is St. Croix County Public Health does conduct a vaccine clinic, as well as our hospital partners and pharmacy partners for long-term care. So this is only for St. Croix County Public Health Vaccine Clinic and our supply. We do request our vaccine from the state, and this is the vaccine that we receive from the state. Kelly's going to go into this process and how this happens within the presentation, but this is a way to know what we as a public health department and running our vaccine clinics do have available for vaccination. The last graph here shows you how many vaccines then have been administered by St. Croix County Public Health during our vaccination clinics. So we're seeing again the week 1, our week 2, and week 3. What someone may notice is that the vaccines that we were distributed, 100, 200, and 200, we are able to give out more than that amount that we actually received. Why is that? Because under Pfizer, which is the vaccine that St. Croix County has admitted, under their emergency use authorization, we are allowed to have, there is an extra dose that is approved within the vial to be used. And therefore we are doing our best effort to maximize the amount of doses we're able to provide. And therefore this is why these numbers are a little higher than they are in the previous graph. One thing I did want to go through quickly is there is great interest in the vaccine, and we want everyone who wants to get the vaccine to receive a vaccine. And so I want to quickly go through how to go through that process. How we're going to access that is through the St. Croix County COVID-19 website, which can be accessed right here on the vaccine page. So as I pull this up, we are accessing the St. Croix County, Wisconsin page. On the front page, if you just Google St. Croix County, our website, the top page will have Learn More of Vaccines. Click on this and it'll bring you to this vaccine page. This page includes an incredible amount of information for the St. Croix County residents regarding vaccine, COVID vaccine, such as how to get vaccinated, when you can get vaccinated, what to do after you've been vaccinated, and more just general information from trusted scientific sources regarding the vaccines. So how to get vaccinated? If we go to the section here, here are the steps. So there is vaccine phases, which currently we're at 1A and B, and that determines who we're vaccinating. But if you do want to be signed up, we ask a couple things. You may go ahead and request a vaccine. So this is your notification to us that you want to be put on a list for a vaccine, okay? There is the priority group again, so note that even if you fill out this request, it does not mean you will be vaccinated next week or the week after or the week after that. There is a priority to who receives the vaccine, and we do have to follow that. And that is set by the state of Wisconsin and a specialized group involved in the emergency vaccine distribution. So as we scroll down, there are priority groups that relate to those phases we discussed. Once you fill out, so if we were to fill for myself, I am part of the general public. I am not 65 years of age. I do not have, I'm lucky to have no underlying medical conditions. So I'm requesting for myself. I'm going to go ahead and click next. When I'm an individual, I will go ahead and enter your full name. So full name, Jane Wendy Doe. I am 18 to 64. My current age, just let's go ahead and say 50. A primary email address, go ahead and enter in. If you do not have an email address, we ask that you do reach out to someone who trusted within your network that does have an email address and can alert you to these, and you can be in communication with them. It does work best for our system in setting up appointments that the notification comes through email. We do understand that not everyone has an email, but if there is the ability to record an email, we ask that you do. Okay. Primary phone. We ask that this be a phone, if possible, that can receive text messages. If not, we understand not everyone has the cell phone. Your primary home phone number is acceptable. Street address, city, and zip code. All right. So the next question is, do you seek care at one of the following? One of the reasons we are asking this is that currently these clinics and hospitals in our area are reaching out to individuals 75 and older to get them signed up for vaccine. And so if you belong to one of these primary care physicians, we will be working to transfer your name and information to them to make sure that you're included in their vaccine clinic. Okay, we're in arrangement, so we can go ahead and say arrangement. So here we are. We have completed all of the required information, consent. So just please understand, vaccine is limited. Once you click submit, we will store your data and use it in contacting you for a vaccine appointment at a later date. And what I do want to make known is once you hit submit, even though you supplied a phone number and an email address, there will be no notification for you. Okay, your only notification is thanks, this is your confirmation. Okay, you will not receive any separate alert that you have submitted. So please just understand, once this page has committed, we do have your data and the process will move forward from there. What has happened is people have called to check, and we understand there's concern, but know that everything is secure. We have a great tracking system and there is no need to call and verify, okay? Now, if you aren't able to complete this process, if someone in the community isn't, we'd like everyone to know that there is the ability to call us. However, we have a very limited staff, and so you are able to leave a message. We will call you back, but the most direct way is to have this form filled out. It can be filled out by another individual on your behalf. That is completely acceptable, and we encourage that should someone not have the capabilities to maneuver a computer or have internet access or a computer of their own. Okay, I'm going to return to our presentation.
Ellie, I've got a quick question right here, if you don't mind.
Yeah, of course.
This is Dave, and I thank you for all your time yesterday morning, and to Kelly, you last night on the phone as well. Can we go back to page 3 for just a quick second? That listed all the different pharmacies or clinics and stuff. And I guess my question is, are you asking folks to notify their clinics, or will the clinics notify them before they fill out this short questionnaire, or do they go to the questionnaire first?
Go ahead.
I'm going to take that question. We continue to meet with all hospital higher leadership on a twice weekly basis. We have been alerted that from the CEOs and chief nursing officers from all the clinics and hospitals we are meeting with, that they have already started contacting 75 and older population. So I just don't want to overwhelm their system either. Really want vaccines. I'm not saying don't call your provider, but know that the process has started and those clinics are working on their patients of record and calling and setting up appointments.
Thank you. I think that's very helpful.
Judy Ochterhoff with one comment, if we can do that now.
Should we finish?
It goes with the phone number. It'd be nice if you added a phone number, preferably one with text facilities, because that wasn't on there, and I use my home phone, which is not text. If you
and
had
that's totally
that
okay.
Okay, I just didn't know you mentioned that specifically, but it wasn't on the form, so that was confusing.
Right, and I don't want to confuse anyone. Just know that there is the ability to send a message by text with a link. And so it is, if that is your primary, if you have a cell phone, usually people do carry that with them. So it is their primary form of communication instead of at their home. And so we would ask if this was a vaccine request form, that if we were going to be using that as a point of contact for you, that it would be the phone you are most actively using and have around you. Okay, I'm going to take that. Oh.
Does anyone have any questions for Ellie related to the data before I just finish up real quick talking about kind of the vaccine rollout?
I have a question. Mr. Chair, may I speak?
Go ahead, Supervisor Hanson.
Thanks. So during public comment, somebody made a statement that the vaccines were not approved. I find that to be outrageous, and I'd appreciate it if you would address that.
Sure. What I heard the speaker say is, the speaker recognized the vaccine was approved under the Emergency Authorization Act, and that is true because our whole country is in a state of an emergency, because the fast process that this vaccine went through to become approved. It's a FDA Food and Drug Association designation, if you will, regulation that they put into place during times of an emergency. That's why it's called the emergency authorization use. And yes, these vaccines have been studied. Obviously not in the length at which we have studied other vaccines, but they go through rigorous clinical trials before we start injecting vaccines into people.
Supervisor.
So these vaccines hadn't been gone through a a clinical trial, we wouldn't be using them if the government hadn't approved them for us to use. Is that correct?
That is absolutely 100% correct. When we were getting excited about vaccines, there were over 300 different types of vaccines from various manufacturers that were making it to various parts of the clinical trials. That's a lot. That's like one brand of vaccine, over 300 of them. Right now, we have the two that made it to the top, and Pfizer moved under emergency authorization use. And I think in the UK, the Johnson & Johnson and potentially an AstraZeneca brand of vaccine are either have been approved, one has been approved and one is very close to being approved. So I anticipate good news. The Johnson & Johnson vaccine is a 1-dose series, which will make rollout and administration it'll be good. So we're calling people back to get their second booster dose for vaccine.
Thank you.
Supervisor Osnes?
Kelly, and again, thank you for your time last night. If we go back to the total number of vaccines that have been given so far, one of the questions that I asked you last night was for the Wisconsin or the county residents that go to a clinic, say in Woodbury or in Stillwater. I know we've had problems before that those doctors would send stuff to Minnesota DHS. They in turn would send it back to Wisconsin's DHS before the county had those numbers. Could you tell us where we're at with that right now? Is there a delay? So do we have are the numbers accurate?
I will tell you what I know. So we both, the state of Minnesota and the state of Wisconsin, both have immunization registries, they're called. Ours is called the WER, Wisconsin Immunization Registry. Minnesota's is called MIC. I do know that in the state of Wisconsin, most all clinics, hospitals, local health departments, labs, anybody, pharmacies, anybody giving vaccines are highly encouraged to register as WER providers. So when they give the shot in the arm, they have somebody inputting data that says what lot number, what vaccination those people got, when the expiration was, any fast adverse reactions to that. I'm gonna turn that to Ellie. I know MIC, so the Minnesota system, so the question you asked related to if I go seek care at Woodlands and Woodbury and get my vaccine over there, will it be an immediate dump? I do know it's not an immediate dump. Systems are talking to each other, and within like 24 to 48 hours, we could pull up a Wisconsin resident and see that they were vaccinated in Minnesota. But I just want Ellie to clarify if she knows that dump from MIC to WER is happening quickly.
Yep, and so Kelly is right regarding the immunization registry systems across from Minnesota and Wisconsin. The data you are seeing is up to date as of everyone who has entered. And so Minnesota, it is a simultaneous system where it dumps right into us, into our numbers based on address, so based if they are St. Croix County residents. Unfortunately, what we aren't able to control across the board, nor is anyone within the state of Wisconsin or Minnesota, is if people aren't timely in that entering. Now, Wisconsin has mandated and Minnesota has well that those need to be entered day of or as quickly as possible. But unfortunately, there isn't a correct system of policing that information at this time. So the other piece, which brings up a great point, and I appreciate for it being mentioned, if there are questions on these numbers, I do encourage individuals to press on the link here, which is learn more about our data, where these numbers are discussed in relation to where are they coming from, how are we counting them, and hopefully answer any questions that may arise.
All right, Ellie, can you scroll down so we can continue on the presentation? So this is a slide that the state shared with us, and this kind of takes us through all of the different pieces of the federal vaccine allocation and how it really ends up at a local level or your local clinic or your local hospital. So I think we can share these slides. So if you have questions related to this, please don't hesitate to reach out. We can make sure we get this on our website if it is not already on there. I believe Adam did put it on there. Okay, Ellie, next slide. So this is our rollout vaccine. We were alerted by the state DHS Health Department that the state is really looking at going away from calling out 1A. C. I think they are moving to language on persons up next and persons currently available to receive vaccine. Our group that we work very closely with in Western region, kind of on a regional level that extends from Douglas County all the way down to La Crosse County and over to Clark County, we kind of like the phased approach with the 1A, 1B, 1C. We think it gives a little bit more priority because I know I've even fielded emails this morning from a school nurse that said, so your dashboard says you are on 1A and 1B. Healthcare or schools are in 1B, so why aren't we getting vaccinated? And this graph really kind of talks about all the different priority groups within the 1B or 1A to 1C. The green, and I realize these are not great colors for those that are colorblind, and I apologize for that. So if you look at 1A and 1B, those first two boxes in 1B are filled with a green color. So those are the priority populations that everybody in St. Croix County is currently working on. And when I say everybody, I mean St. Croix County Public Health all the way to clinics and hospitals. We have been given a tentative date that our schools will likely be that this 1B category will be open as of March 1st. I know that is a month away. I think the smartest thing I heard related to vaccine planning and administration is managing the public's expectations through this process, and that has definitely proven to be something we need to do in St. Croix County and are trying to do. Next slide, Ellie. Okay, so I was a little bit off on my terms. The state is using current eligible, next eligible, and future. So this just puts a little bit more information related to who is currently eligible, who is next up, and they have a tentative date here of March 1st. And then future will be, dates will be determined, and the essential workers, which is a huge group that I don't know at this time if the SDMAC, so that's that State Disaster Medical Advisory Group, the one Ellie has said is making these prioritizations for the state of Wisconsin. I don't know whether or not they will be giving out timelines or prioritizing essential workers like we have seen a lot in 1B and 1A. Okay, I think next slide, and I think it's just questions. Sorry, we have gone, oh, she didn't put my question slide on there. It's okay. That's all we have for you today, but take any more questions. I know we've gone over.
Mr. Chair, could I ask a question?
Supervisor Leaf, go ahead.
I'm wondering, Kelly, if you or Ellie have noticed a difference with the new federal administration in terms of rolling out more quantity of vaccine. I know it's been kind of a haphazard process previously, but I'm wondering if you're seeing any positive changes in that regard.
I can honestly say, as of now, no, I have not seen any changes, nor have I seen increased communication from the state to locals, which is definitely a concern of mine and something I'm very local about on the state level. So if you have you have a health officer who asks a lot of questions, it is not a lie.
Supervisor,
I'm sorry, did you have anything?
Supervisor Asmus, did you have a question?
Yes, sir. And my last one, I promise.
Thank you.
Kelly, to this point in time, how are we sitting receiving vaccines? Are we coming up short, or are we getting basically what you've asked for?
Actually, last week was the first week I requested. We've increased our allocation requests every week because we know how to do mass clinics in public health. So we kind of got our feet wet a little bit with the first week we started this with asking for 150 doses. The following week we moved up to 200. And then last week we asked for 400. We know we can increase our capacity and likely be doing many more vaccines. So even last week, I did make a request for 500 vaccines. And just really quickly, I make those requests. I get like less than a 24-hour window to make the request to this state on how many we think we can give in St. Croix County as St. Croix County Public Health on a week-to-week basis. And I requested 500, I got 0, which was interesting. I know everybody has received some allocations. Allocations are really, really short this week, and the state tells us we should probably plan that for the following couple of weeks. There's a lot of reasons. More people, more groups in the state of Wisconsin are becoming vaccine providers, which means then they're requesting vaccines. And when the state is only receiving 70,000 vaccines on a weekly basis, the allocation, the requests are like close to 300,000. So we're not even fulfilling a third of what the requests are out there. So no, Dave, I'm not seeing, we're not getting what we're asking for.
The administrator has a question also. Go ahead, Ken.
I was going to ask if Adam had an update for the county board on the public health mailing.
Yes, I do. Can everyone hear me?
Yes.
Good. Okay. So we had our first newsletter communication go out a couple weeks ago. We had worked with the ADRC to send out information about vaccines, albeit general information, to the populations that the ADRC serves. That hit mailboxes, I believe, 2 weeks ago. We are finalizing our second newsletter. This will be the general public health newsletter, and that is slated to be in mailboxes by the end of next week. That has a little bit more information about vaccines, what we've learned since the last communication. We do, in all of our communications that we send out, we do add the disclaimer that, you know, this is a fluid process and information is changing. So please check the website for the most current information. We do realize that not everybody has access to the website. So we're going to try to, particularly in our older populations, so we are partnering more with the ADRC to increase messaging to their populations, which will be more communications in their monthly newsletter, as well as other mailings and stuffers that they have for Meals on Wheels. So we have a plan moving forward. We're working closely with people throughout various departments in the county to help get this message out. But this next message that we have coming out will tentatively be in people's mailboxes by the end of next week.
Okay, thank you for that presentation. It was very extensive for the HHS. It was well received. And Supervisor Telejohn, question.
Yeah, I hope it's a quick question for Kelly. Westfield Clinic Hospital is Health Partners. Do their supply come from Minnesota, because it's Health Partners, or does it come from Wisconsin?
That is a super great question. So most all our healthcare providers have motherships in Minnesota. Vibrant Health Partners, as well as Hudson Hospital, because they are also health partners. Their supply does come from the state of Wisconsin. They had to register as Wisconsin providers, and they are getting their vaccine from Wisconsin. Really good question.
Okay, no further questions. We'll proceed on with the Supervisor Otino, I'm sorry. Unmute, please. Unmute. We're unable to hear you. Would you unmute, please?
Thank you. Yeah, I just wanted to add on. I was scheduled because I'm 70, and I got scheduled for my first injection tomorrow. 3 days ago, I got a call that they did not get any of their allocation, just as you had said there. I just hope that we don't add on the next group before we finish the last group, because it's just going to make the problem worse. So thank you very much for your presentation.
And I just want to address that really quick, because that is happening. We don't have really a lot of control over that at the local level about adding these groups. And when they get added, they are definitely, the state is definitely hearing from locals, please don't add any more groups. We are estimating about how many numbers we have in our county for the current groups. And I mean, it's a lot of people. It's roughly around 10,000 people. That's going to take us some time to get through 10,000 people, even when we have 4 to 6 providers giving vaccine in our county. So sorry, I don't mean to take time, but thank you for that comment.
Take all the time you need. Okay, did I miss anybody else? I guess we're ready to move on, and thank you again. County Administrator's Report, Ken.
Thank you, Chairman. The financial report is in the packet. These are preliminary December numbers. I have reviewed these, even the updated numbers as of the end of last week, as we posted some additional year-end closing. What I can tell you is that the numbers are looking very good for us, considering the rough year everybody's had personally. Financially for the county, the two main saving points were the Routes to Recovery grant that we received. We'd got about $1.8 million from that. And then also sales tax had exceeded expectations as people were doing more online shopping than driving across the river to shop. The expenses, while they are higher in some departments, they were mostly offset by the additional grant revenues that we've received. So overall, I think the budget is looking very good. I can pretty much guarantee you at this point that we will finish in the black overall for the county. I'll entertain any questions that you might have on the financial report.
Questions? Comments? Seeing or hearing none, then the second item on your agenda.
Yeah, let me scroll down to that. So this is kind of in honor of Groundhog Day. Because I've answered this question probably 12 different times about the different meeting options that we have. So I just put it in writing. I put it on the agenda so everyone could understand where we're at. So I'm not making a decision to move back into in-person meetings. What I'm explaining to you is the rules that you've already set up that take us back there. They have expirations on them. So I'm giving you plenty of notice that these are the time frames that we're looking at to go back to in person. So if there is a need at some point between now and July to extend that you have the opportunity to do so as the county board. The only thing that I'm probably making the decision on is to save the $1,400 and not renew that Zoom webinar platform option. I sort of looked over at Supervisor Osnes because he's the only one that's really been utilizing that very much. But if there's a strong demand that we continue that option, then I would spend the $1,400, but otherwise I was going to let that expire.
Supervisor Achterhoff?
Supervisor
comments?
Achterhoff, go ahead.
I would like it continued because we have no idea how long it's going to take care of the situation. And by discontinuing that, we're making it so people have to physically come to the meetings if they want to make a statement. Otherwise, they can send in a paper. But I just, for $1,400 a year, which is pennies per resident, I just see that it's valuable. And I would also love it if every committee had the same type of meeting. I have gotten complaints from some of my constituents saying, well, how come they have the information to get on this meeting here, but they don't have it there? So those are two separate things, but I would like it. I believe that the price is worth having our constituents have the availability to make comments if they so choose. And I would also like this, it's saying Zoom meetings would end at the end of June. Well, let's say you're in a household with your kids and your grandkids. The chances of them all being vaccinated by June are slim. So if you make us come there, we may be vaccinated, which means we won't hopefully get the COVID. But when we go back to our homes, we're going to be possibly giving it to our kids and or our grandkids because they probably have not gotten vaccinated yet. I would like that continued until everybody who's had a chance to get vaccinated has been.
The administration committee will be reviewing that as we approach the time, and I believe I had a Supervisor Burning. Did you have a comment?
Do we not have any other technology already included in Office 365, like Teams, that we can utilize? Because Zoom is an extra expense, but a lot of times Teams comes with Office 365, and I'm wondering why we don't utilize that, or if it is possible, or...
We do use Teams internally, and it's available to you all also. There's Teams forums, I guess, but it's really not as robust as what we get for $1,400 from the Zoom offering. So I know that Adam has had experience, our public affairs officer, has had experience working with the Teams. It's kind of like being in an auditorium. Everybody's in the room. He's worked with that before at the state of Minnesota. We can get with him and ask him a little bit about it. I did confer with him probably 6 months ago about it, and he just felt that the Zoom option was a better option than the Teams option was. So, but we use Teams extensively inside. I'm sorry, Adam. We do use Teams extensively to communicate within our building and our offsite workers at this point. So, Adam?
And Supervisor Burning, I can talk to my piece of that. Working with it in the past with the state of Minnesota, Teams has an option called live events, and that's really more of a broadcast. It's more of a one-way communication, whereas the Zoom webinar piece really allows for that interaction piece, which is what we use for public comment. The live events piece with Teams, the last time I had used it, it's more of a chat feature versus somebody being able to vocalize their public comment.
Mr. Chair?
Okay. I just thanks, Adam, and thanks, John. I appreciate that. And once again, mark it down. I agree with Judy.
Supervisor Anderson, I believe you had your hand up, did you?
Yeah, correct me if I'm wrong, but the expiration of being able to attend and vote via or virtually is based on a decision the board made to extend the emergency authorization, correct? So that's not your decision.
There's two options for you. One is the rules and bylaws prohibit online participation or remote attendance. The emergency order, the county administrator has made an exception to that policy. So you have a policy that you could change, or you have an exception that expires at the end of June. So those are the two routes that you have to alter that if you so desire.
Mr. Chairman?
I believe Corp Counsel wanted to make a comment there. Unmute, please.
Yeah, please Please know that I'm working on a suggested change to the rules and bylaws, which would allow this under some conditions. So it, depending on whether the, ultimately the county board would adopt that, further emergency declarations for this purpose may be unnecessary.
Supervisor Telejohn, you had your hand up.
Yes, I was going to mention what Scott just mentioned, because didn't we have a bulletin in one of the new county or Wisconsin newsletters saying that we have to change our bylaws if we're going to continue doing emergency like this? I think there was an opinion in there.
We're taking that as a suggestion then, and I believe also Supervisor Attino had your hand up.
Thank you. I'm having a hard time understanding why we're worried about $1,400 for the year. And again, I would agree with Supervisor Achterhoff. We need to continue this, and if Scott Corporate Counsel can manage that a different way, that's great, because we do not know what's going to happen, and we don't know who's going to be vaccinated, and there is another strain coming. So we voted to spend $3 million on a garage, and we're debating $1,400 for a year for something that's very useful. I don't see I think we just got to extend it. Thank you.
Thank you. Supervisor Hanson.
Two things. One, I'm getting, I think there's some nuance here. I think the $1,400 might not be the entire picture. That there's some difficulties, not necessarily difficulties, but staffing a Zoom meeting isn't necessarily easy, and it's done from sometimes the highest levels of our administrative staff. It's time consuming, it's expensive. If we were actually looking at the real labor cost of doing these Zoom meetings, it's getting to be pretty expensive, and I think we should explore a more user-friendly or less costly way of doing them. And that needs to be a conversation probably at the administration committee. So I think the $1,400 is a surrogate conversation for a different set of issues. And the other thing is, when you're talking about changing the software that we're using, I'd like to speak on behalf of the troglodyte contingent, which isn't insignificant with this group. I don't want to learn a new software. I just learned this one. So I kind of want to stay with the platform that we're on.
Supervisor Ard.
Thank you, Mr. Chairman. I am on conference calls and online conferencing every day, and I will tell you, Teams is very effective and efficient if you are working within your organizational system. However, in the interest of public comment and upholding the right of the public to participate in our meetings, the Zoom platform is far and above any other platform which is currently available to us. The price is right, far lower than many other options which are out there. So I would strongly suggest that this board, when considering the input of the public and participation of the public, as well as ourselves, that we continue with the Zoom platform and look forward to Corporate Counsel Cox's suggestions on amendments to our rules and bylaws for continuing Zoom interaction within county board meetings.
Supervisor Osnes.
Ken, a year ago when we first looked at this, the county already had a public health ordinance in place. And correct me if I'm wrong, did we receive COVID money to cover the costs for Zoom and what we're doing right now? And if we did, if we're going to continue with possible COVID money, we'd have to bring back another extension in the 1st of July for a public health emergency. Is that an option?
Yeah, I think maybe two parts to your question. One is the cost. So the cost for the Zoom was originally paid for out of the Routes to Recovery grant. So that's how we initially covered it. Upon the renewal coming up in April, I do not have a grant that's currently available to us to cover that cost. So it would come out of the county's general operating expenses. And I might be a little bit more frugal than some of the people here, so for suggesting that. And then the second part of your question was about the extension. So you have two different methods of allowing for online participation. One would be to extend that emergency declaration, but that's not the only solution for you. And what Corporation Counsel Cox had explained was he was working on the alternate solution, and that's amending the rules and bylaws to allow for it permanently going forward under certain conditions.
So then I guess my next question would be back to you, Mr. Chair. Do we have to make a motion to have Corp Counsel write anything up? Is a change for our bylaws?
No, he's in the
Some
process.
type of resolution or anything?
He's in the process of resolving or reviewing them now, and he has his work charged to him. Yeah. It'll be on the March agenda. Okay, I think that probably covered most of the questions there. Any further? Seeing none, I sense that perhaps do we need a short 5-minute break? Supervisors on the floor, are you okay? Oh. We'll continue. We have no need, I guess. So next then would be the business items and the resolution approving the land use jurisdiction agreement between St. Croix County and the City of River Falls. Ken, are you going to introduce that? I guess, do we need a motion for that? Do I have a motion to bring that to the floor? Supervisor Osnes? Do we have a second? Supervisor Shatner, seconds. Discussion. Go ahead, Ken.
Yeah, thank you, Chairman. So this is an agreement that came out of the Community Development Committee. We turn over the zoning jurisdiction and land use around the City of River Falls in the area that they have a boundary agreement with the town of Kinnickinnick. So they're able to apply the zoning and future land uses that mesh with their future growth patterns per their agreement. And this basically takes it out of our community development office from administering that over to the City of River Falls to administer that. This is permitted by state statute, and that's what this resolution is approving.
Questions and comments? Seeing none, I guess we're ready to vote on that then. Okay, all those in favor of the agreement signify by the resolution, I should say, signify by saying aye. Aye.
Aye.
Aye.
Those opposed, sign the same. Carries unanimously. Thank you. Next item would be a resolution authorizing continuation of the self-insured workers' compensation program. Do I have a motion to bring that forward?
I'll move.
Supervisor Cook? Do I have a second?
Second.
Second was from Supervisor Ard. Thank you. Discussion.
This one is very routine. St. Croix County maintains a self-insured workers' compensation program. We're required every 3 years to recertify our intent to continue as a self-insured work comp provider with the state of Wisconsin. And so that is up this year for renewal.
Questions, comments? We're ready to vote at this time. So all those in favor of the resolution authorizing continuation of self-insured workers' compensation program signify by saying aye. Aye.
Aye.
And opposed, sign the same. Carries unanimously. Thank you. Next item is the resolution authorizing fund balance transfer. Motion to bring that forward.
I would
Supervisor
move to
Ross?
approve the fund balance transfer.
Okay, Supervisor Ard makes the motion, second from Supervisor Osnes. Go discussion, Ken.
All right, thank you again. So with this resolution, we're transferring money from the HRA fund to the HSA fund. So the HRA is a health reimbursement account. So that was created by the county dozen or so more years ago as a component of our health insurance plan. We have a self-insured health insurance plan, and we fund that in a separate fund. And then we created an HRA component, which was used to offset employees' deductibles when we had a higher deductible level. So a couple of years ago, we amended our plan to lower the deductibles and eliminate the HRA component to that. So we phased that out over the past year. So we did that to simplify the plan, make it easier to administer. An HRA is different than an HSA. An HSA, health savings account, stays with the employee. An HRA, unused portions stay with the employer. So these unused amounts are sitting on our books and available for us to reallocate now that there will be no future expenses against this. So when I looked at what our potential options would be, our interim finance director suggested the RHS fund, which is a retiree health savings account. So the way that is used is when an employee retires from St. Croix County, the amount in their long-term sick bank is converted into cash for them at their rate of pay and put into an account that can only be used for health-related expenses. That fund, historically, over the past 5 to 10 years, has dipped into the red a number of times, and we've had to use undesignated fund balance to bring it back up to zero. Because we've had some long-term employees from the county that have retired. So as we continue to do that, it has a negative fund balance at the end of 2020 by $353,000. So what I would suggest is that we transfer the full HRA fund balance to the RHS. It brings that balance back up into a nice positive range, which will help us over the next few years. They're both health insurance related. One was for general employees, one is for retirees, but it's the same general concept, so I thought that was a good shifting of these dollars to stay within the same medical related and fix a problem that we have on our books.
Questions, comments?
Judy.
Supervisor Achterhoff again.
Supervisor Achterhoff, go ahead.
I got two questions. One is, where is the money that does go into the RHS fund coming from? And how come not enough was put in there?
Yep. So we estimate, we look at a 5-year average when we look at that RHS fund and estimate the amount that should be put in there. So that amount has been growing steadily, but that comes from general fund tax levy. So as we're very restricted on tax levy dollars, what we can allocate, it's tough to allocate a lot of additional dollars to that when it's peaks and valleys of people retiring that are going to use it. So I don't necessarily want to, not support a program 1 year in the budget because I want to put additional money into the RHS fund and then have it not be used. So I have been a little bit conservative with the total levy that's going into the RHS. We did increase it from $200,000 to $250,000 for 2021. But again, I'm being conservative with that because I don't want to end up costing us a program that has a more direct impact just to support the RHS fund when we do have other means of fixing it when it runs over.
Thank you.
Other questions? Seeing none. Let's see, I guess we're ready to vote on that. So all those in favor of the resolution authorizing the fund balance transfer signify by saying aye.
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 And opposed? Carries unanimously. Thank you. County Treasurer Annual Department Report. Denise, I believe you're going to handle that.
Yep. Thank you, Chairman Peterson, and good morning to everybody. My report is longer than what I've submitted in the past few years. I wanted to include at least a brief summary about some of the irregularities and the challenges we faced in 2020. It describes some of, at least a little bit about some of the lowlights and the highlights of our year. And then I just had 2 points I wanted to add this morning to that. First, in the report, I mentioned the increase in the number of people that are using the online option to pay their property taxes. Likewise, in this past month of January, we had payments of 2.1 million compared with 1.4 in the month of January in 2020. There were 714 payments received online compared to 552 for the same month last year. Of course, we do expect to see that trend continue as more people become familiar and comfortable paying this way. Customers, including taxpayers and mortgage companies, also use our website more to look up their taxes, print a copy of their tax bill, and print a receipt and check to see whether a payment is made or received. So that's helping alleviate at least a few of the phone calls in our office. Title companies also use our website to find mill rates and estimate taxes for new homes. On the flip side of that, the second point I wanted to make this morning is that while there is more use of our online payment and search option, we do continue to see a significant number of people who want and or need to come into the government center for service. There are people in our community who do not have a computer at home, they don't have a printer, and they want a printed receipt either for their own records or for their income tax preparer, and even people who don't have internet access at home. Even one of my own seasonal employees doesn't have internet access at home. So I had 2 people at our counter all day the last few days last week, and at least 1 person at our counter, with additional coming up to help when it gets busier than that. And it just signifies that there's still this need for people to come in asking for service. They come in and ask questions to get clarification about the tax process. They're looking for information about properties they've purchased, sold, or split. They come in to fill out a lottery credit application or to provide an address change, and a variety of other reasons. So while the website is still a valuable tool and we'll continue to look for ways to make that better and more accessible to more people, we continue to encourage that use. There's still a segment of the population that wants to talk with a real person, and the website's not a realistic or viable option for them. So those customers are still just as important to us as our online customers. With that, I'm happy to answer any questions you might have.
I have one myself. That would be when one chooses to pay the taxes online, is there a charge if they use that method or not?
Yes, so Point and Pay is our online provider, and they do provide access, the same access for a lot of the counties in Wisconsin, and that fee is the same. It's 2.39% if you use a credit card. We did negotiate the debit card charge down to a flat fee of $3.95. And then if you use an e-check where you're just entering your bank account information, it's $1.50 flat fee. So.
Thank you. Other questions?
Supervisor Octoroff?
Supervisor Ochterhoff, go ahead.
With reading about what happened with Wells Fargo, do we have to use them? I mean, it sounds like they were not very respectful to us.
That was really difficult. That was correct.
Yeah.
And my representative was not even aware of that branch was closing. I've had numerous meetings with him and some of his supervisors about, I've gained assurance that branch isn't going to close. I don't know that I trust that 100%. But changing banks would require putting out an RFP, and we are very integrated with Wells Fargo right now. There's a lot of services that we use that a lot of banks might not be able to provide. It's something we'll consider putting out an RFP maybe this year or next year.
Personally, I think it might be something worth checking out at least, because that, I mean, hopefully we don't ever treat our citizens the way Wells Fargo treated us.
I agree.
Further questions?
Did I miss something? What's the Wells Fargo branch? Did I miss reading something?
Supervisor Telejohn, go ahead, Denise. Did you want to answer that question?
Right, so we still get a lot of checks. We still are receiving a lot of physical payments here at the county, you know, for all of our different departments. And we have a service truck that brings, secured service that brings our deposit daily down to the Hudson Wells Fargo branch. And they closed with only a one-day notice right before Easter holiday weekend. So that was the difficulty we experienced in our office. We had to work with the sheriff's office, administration. The government center was closed, so even for security to get in was an issue, and to deliver the deposit to our courier was problematic, and it changed daily. We were given the option to bring the deposit either to Woodbury or to the Stillwater branch, and they had limited hours. Our truck didn't necessarily go there, and their routes are different every day, so there were a lot of obstacles and difficulties that we worked through. Does that answer your question?
I think it did.
Yes, I wasn't aware that the branch in Hudson closed. So where are you putting the money now?
It's open now. It was closed. Yep, it's open now. Yep.
Further questions? Yes. Okay, does that complete your report then, Denise?
Yes.
Thank you.
Yep,
Very
thank
good.
you.
Thank you. Okay, next would be County Clerk and Department reports. Cindy?
I'll take it from here. My report is in your packet. I am just going to highlight a few things. We administered 5 countywide elections in 2020, and the COVID-19 pandemic added more challenges to the election process. The Elections Commission did get county clerks involved they were supplying sanitizing supplies for polling places, and they just shipped them to the counties to distribute to the municipalities. So we had about 3 shipments come in, and we had to distribute them. We also had to track where they were going. The other thing was the coordinate National Guard assignments. So if a municipality needed assistance at the polling place, then I had about 30 National Guard come in before the April spring election, and had them assigned to various places. Clerks were unsure if they would have workers. So it was nice to have that option with the National Guard, and I did hear positive things from clerks about the National Guard presence and assistance there. So in addition to that, the absentee ballot increased requests, and which left us short of supplies, absentee envelopes. And so we did have, clerks got very creative, I think, in printing some of their own when needed. Our main supplier, Bear Graphics, their warehouse shut down when COVID hit, so we weren't going to get any from them. The state did step in and get some printed. I actually had a supply of 10,000 come in to the Richmond Airport, flown in, and someone from the facilities department went and picked them up. So we were constantly distributing and trying to get things out for the assistance to the municipal clerks. I did put a chart in the report which shows, I compared it to the November 2018 general election, the gubernatorial election, and that was the total number of voters, and we had 7,800 absentee requests. If you go down the line a little bit, you'll see in November of 2020, we had 56,846 voters and 29,481 absentee requests. So you can see the significant change in the increase in demands from the clerks. The clerks issue the absentees, so they had a lot on them all of a sudden. We had about an 85% voter turnout in November of 2020. We did have an opportunity to apply for and received a grant. It was the 2020 County Election Security Grant in the amount of $54,800. I worked with John Allegro, IT Director, and we were able to obtain an Albert sensor. I didn't know what it was, but it helped with the security. It's an appliance and subscription service that monitors our internet use for malware and hacking. Also, we're able to recover some costs with the absentee envelopes through the Routes to Recovery grant. So we also had changes in our office, procedural changes, issuing marriage. We still had to issue marriage licenses, even though several weddings were postponed, and passport applications and work permits. So we did develop a no contact and appointments only type process for that. So I did put in the list of, in the report, the number of marriage licenses we issued. We weren't down that much. I think people still got married and so still had ceremonies, probably a little bit smaller than what they had originally planned. The waiver fee, so we have a $10 waiver fee. There's a 5-day waiting period for a marriage license. We can issue it on the 6th day. It can be waived by paying an additional $10, and we encourage people to do that, just to take it with them the day that they applied, providing they provided everything that we had required to see. Obviously, passport applications were down, but we've been processing a lot in January. People are still planning on traveling, I believe, in March or later. So other than that, one thing that I did miss for 2021 objectives is the redistricting process that will begin this year, and I do have training tomorrow on that. And I did get an email. I talked to Supervisor Peavy. He got the same email where the census information is delayed. It's supposed to be there by March 31st, and now it's going to be after July 31st, I believe. So it'll be an interesting process to see how that will be handled this year. And of course, we work with the Community Development Department on that, the mapping experts there. So I do have some thank yous. You know, I had Highway Department helped with picking up sanitizing supplies. They had to drive to Eau Claire. Facilities Department making a rush to the Nourishment Airport. We had just a short time frame to pick that up. My staff worked really hard in just the entire election process this year, plus the changes that we've made. And the municipal clerks deserve a big thank you for what they went through with the election process. I would like to thank Bill Peavy. He's not running for clerk treasurer in the town of Eau Gallie this year. And he thought he'd hang it up after 40 years. So he's maybe 2020 did him in. It did. And then, of course, thank you to my staff for what they do. And any questions?
I had one, Cindy. I thought I saw something.
Sure.
You're next, Judy. I thought I saw something on the voting machines and the hand sanitizer, that there was maybe an issue with that. Did we have any of that, or was that resolved?
No, they were. I think what was happening, you get alcohol wipes to clean the touch screens. I think that was causing an issue. I didn't have any known issues in St. Croix County. It was encouraged, if you're using the touchscreen voting system, to use a Q-tip and then throw it away. So that was encouraged. So.
Thank you, Cindy. Supervisor Achterhoff.
What's the I do board?
Yes. Well, we are putting together, this was an idea from Administrator Witt, and it's just going to be a board of some sort for couples to do selfies after they apply for a marriage license. So it's kind of a happy thing for people to see. We're still working on placement and what it's going to look like. Washington County in Wisconsin does it, and so it's kind of a fun deal. So, any other questions?
Thanks.
Further questions?
I have a comment.
Supervisor Schottner, go ahead.
I just want to thank Cindy and her staff because that was a very taxing year for the 5 elections, because I know from my own municipal clerk how taxing it was, and all in all, it finally went well. So thanks for your service.
I too would like to add my thanks, and also to our other departments. Everybody really worked hard this last year under really tough conditions, so thank you. Accept my thanks on behalf of the board. Next item then would be a request for future agenda items. Seeing none, we have the county clerk's report or correspondence and rezoning request.
I have nothing to report other than a reminder that the March